Hello, Dr. Vicki Peterson here. I wanted to speak with you today about some results from an ongoing clinical trial for celiac disease patients that kind of annoys me, and I'll tell you why. In this ongoing clinical trial, there were 117 celiacs that were analyzed, and they, on average, had been diagnosed more than 6 years ago. So these were not newbies to the gluten-free diet. According to the study, these were individuals that were adhering to the diet as best as humanly possible, so they were very much working on their gluten-free status and not taking it lightly at all. Yet, despite that, 95% of them continued to show inflammation of their small intestine. Of those, 65% of them were so inflamed that their gut, the lining of their small intestine, looked similar to someone who had celiac disease and hadn't been diagnosed yet. In other words, a celiac who was continuing to eat gluten. So these individuals were trying their best. They'd been doing so for over 6 years, yet their gut, 95% of them still inflamed, 65% of that group so inflamed that it looked like they were eating gluten on a daily basis, which they absolutely were not. Even those that had negative antibodies, in other words, their blood test looked like they weren't eating gluten for sure, and they weren't continuing to test positive, they still had inflammation present. So what concerned the researchers was that a gluten-free diet, was their conclusion, was not enough. It was insufficient to really get the job done because all this inflammation was keeping these individuals at an increased risk for many different diseases, including lymphoma, the most common form of cancer associated with celiac disease. So that was their concern. What gets me angry is, if you've listened to me before, you know I frequently talk about the secondary effects of gluten. And what I say over and over again is that for the vast majority of people, putting those individuals, whether they have celiac disease or they're gluten sensitive, putting them only on a gluten-free diet is not enough. Why? Because I've seen the exact same things that these researchers have seen. Not that I'm a researcher, I'm a clinician, I'm seeing patients, but that same phenomena of people following a gluten-free diet, doing their very best, but not feeling better. They weren't talking so much about how they were feeling, they were talking about the fact that they were examining their and biopsying the lining of their small intestine to see this inflammation. But I guarantee you these people don't feel good either, which is more my end of the world. The point is this, that celiac disease is a bit of a forgotten disease. Not only are we terrible at diagnosing it, but even when we diagnose it, we're terrible at treating it. Why are we so terrible? Because there's no drug. And we live in a society that we like to give drugs for things. And you know, you have this disease, well, we can give you that drug, and that will suppress those symptoms and you'll feel better. All we have for celiac disease supposedly is a gluten-free diet, which we offer up. And now what these researchers are correctly pointing out, that I've said for a very long time, that's not enough. So what do? We look at the secondary effects of gluten, and those are not dangerous to treat, they're not scary to treat, there's no weird surgery, there's no bad drug, it's a natural approach. But what we look at is what happens secondarily to being celiac, what happens secondarily to having gluten sensitivity. And yes, you have to eliminate gluten, and you have to be perfect as humanly possible. Yes, that has to occur as step number 1, but then there's step number 2. And the secondary effects involve looking at hidden infections. I call them hidden because it's not like you have the flu or a cold and you're lying in bed saying, I feel sick. You cannot feel physically ill as far as an infection is concerned, yet still have infections. These are things like parasites and amoebas and bacteria that we find in the gut. There are other food reactions, dairy chief amongst them. There are cross-reactive foods. And if you want more information, I've done individual videos on all of these. But The cross-reactive foods are foods that are not gluten, but your immune system thinks they're gluten, and so it reacts as if you were eating gluten. And most of these are not lifelong, but you have to identify them because it's the only way you're going to get healed up. You can have enzyme deficiencies. You can have the good bacteria, the probiotics in your gut are imbalanced. You have more bad guys than good guys, not enough good guys, etc. You can have hormonal imbalance. You can have other types of stressors such as heavy metal toxicity or Lyme's disease. The list doesn't go on and on. You're talking about 6 to 8 items tops. But if these are not addressed, you're not going to handle that inflammation. You're going to continue to be at risk for these other diseases. Chief amongst them, autoimmune disease. Celiac, of course, is an autoimmune disease, and when you have one, you're many, many times more likely to get others. And if we don't address these secondary effects, if we don't heal that immune system, if we don't heal that gut, disease is going to be subsequent to that. And I was really happy, actually, to see this information come out because it allowed me to rant and rave a little bit on this topic. But it is important. It's very, very important that we don't think that, okay, I finally got a good diagnosis, good. They told me to avoid gluten. I'm doing that, good, done, phew, you know. It's not enough. So if you need, and I'm sorry to say that not every clinician on the planet, not every gastroenterologist, by a very long shot, knows anything about the secondary effects of gluten. We coined the term in our book, The Gluten Effect, back in 2009. Not to say that these other effects haven't been discussed, but as far as finding a clinician to help you, it's not the easiest thing in the world. But that's what I'm here for. I'm here to help you, and so I can help you try to find someone in your area. I can help you. We're a destination clinic. We treat people from all over the world. So use me. That's what I'm here for. That's why I do these videos. And let me know. Let me know how you're doing. Let me know what help you need. And until next time, I wish you very good health.